So this is a fantastic question, and itching is absolutely one of the most common things patients experience after any type of surgery. So there's usually two big reasons why this happens and potentially a third. So the first big reason is just inflammation. You've had surgery, you're healing, it's an inflammatory process, histamines are produced, and this type of itchiness is something that's often made better with antihistamines. So the newest generation antihistamines are my favorite. I usually love Zyrtec or Claritin, and that can help a lot with post-surgical itching. Now, the next type of itching patients get usually is a few weeks later after your surgery, so closer to like 3 to 6 weeks later. And this is often when your nerves start functioning again and start healing. And this is a different type of itching. So it doesn't tend to be everywhere, all over the place where you had surgery. It tends to be just a few different places. People often describe it as an internal itching, and this can be really annoying, and it's more of a nerve pain associated thing. So for these patients, there's a few different things you can try. So sometimes heat is helpful. So using a heating pad, be careful not to burn yourself, can be really helpful. The vibrating heating pads tend to work really well with this type of nerve pain or itching. And you can buy those at any pharmacy, CVS. They have like a heating pad that also has a vibrating function. So this can be really helpful. And then for patients that are driven insane by this, because it can be really maddening for a few weeks, you can try something like Neurontin in small doses, especially at night, to help you get some sleep. And sometimes that will get you relief. Now, for most patients, this type of itching will start, like I said, about 3 to 6 weeks and at most last till about 3 months. So this is not something common that lasts long term. It certainly can, but it's not typical. So the last reason I see itching is an inflammatory scar, also called a hypertrophic scar. Now, people often call these types of scars keloids, but it's not really a keloid. This is a firm, inflamed scar, but it stays within the bounds of where it belongs. So if you look at the incision, it's just a thick, firm, like a worm-looking scar. They're often red and they're frequently itchy. And for the same reason, the prior inflammation right after surgery causes histamine release and itchiness. These scars do that too. So if you have an inflamed scar, often the best treatment is something to reduce inflammation. So injecting the scar with some kind of medication that reduces inflammation. You can try topical scar strips that have a steroid in it, but I don't find that this works as well for an inflamed scar. So if you're worried this is happening, let your doctor know right away, because the sooner we intervene, the more likely it is to not only be solved, but that your scar not to be affected and look poor. So with what's described with this commenter's comment, it's typically what I see with people when it's just the typical inflammation after surgery. So for my patients, I would usually recommend, of course, after an exam, trying one of the newer antihistamines. Make sure you ask your doctor. I'm not giving you medical advice. And then it should get better over the next week or two. So it's always important, if you have any weird symptoms, to let your surgeon know, because they're going to be able to give you the best individualized advice so you can get that horrible itching taken care of and have a more comfortable recovery.